A warm welcome to Camnet Television. Camnet, not just another channel. I'm your presenter, Namwinga Mwinga. We now look at the news headlines. Health Minister confirms Mwansabombwe MP died of COVID-19 related illness. Mwembeshi farmers call for early distribution of farming inputs. ZN government recovers 65 million kwacha student loans. In international news, COVID-19 proton treatment trial a breakthrough. In sports news, Ballon d'Or cancelled due to COVID-19. We now take a break. We'll be back shortly for more news after this.
Msika is here. We have you all covered with just 150 kwacha. You can advertise every day from 17 hours to 18 hours. For a 30-second ad, get the benefit of selling your products and services on Msika. For more details, call our marketing department on +260 953 995099 +260 962 444 726 or +260 971 177 467. Email us on info@camnettvafrica.com. Terms and conditions apply.
And now the news in detail. Health Minister Chitalu Chilufya has disclosed that the late Mwansabombwe Member of Parliament Rogers Mwewa died of COVID-related illness. Speaking at the usual COVID-19 daily briefings, Dr. Chilufya explains that the late MP had COVID-19 underlying illness and such as diabetes and hypertension. More in this report.
The late Mwansabombwe Member of Parliament is widely mourned by many Zambians, including the orphans he took care of at Fountain of Hope. He died of the coronavirus, but now it is being referred to as COVID-associated because the late had underlying conditions, as the late was diabetic and had hypertension. The Minister of Health, Dr. Chitalu Chilufya, told the media in Lusaka on the 20th of July 2020 COVID-19 was not the only disease that killed him, as the immune system of the late Rogers Mwewa was weak due to illnesses he had.
Report the death of another member of Parliament, Honorable Rogers Mwewa. May his soul rest in peace. Honorable Rogers Mwewa, Member of Parliament for Mwansabombwe, succumbed at Lemi Monawasa Hospital on Saturday, and details have been unveiled as they have been abused. Honorable Rogers Mwewa died out of complications of comorbidities that he had. He was hypertensive and diabetic, and he did develop COVID. Now, the result for COVID only came out after he died. He was swabbed the same day that he passed on. And may his soul rest in peace.
Now, many have started calling on the closure of Parliament, as some members of Parliament are admitted in hospital, while two have died with one's death COVID-associated. They are saying leaving Parliament open is risking other parliamentarians. Now, in the last 24 hours, Zambia has recorded 178 new COVID-19 cases out of 959 tests done. The cumulative number of COVID-19 cases now stands at 3,326.
In the last 24 hours, we have confirmed 178 new COVID-19 cases, out of 959 tests done, bringing the cumulative number of cases to 3,326. The new cases include 104 that were screened in our healthcare facilities, 97 were in Lusaka, 4 in Ndola, 1 in Mufulira, 1 in Chinabombwe, and 1 in Chingola. 35 cases were contacts to known cases, and these include 19 from Lusaka, 6 from Mufanyamba, 4 from Mufulira, 2 from Mpongwe, 2 in Chipata, 1 in Ndola, and 1 in Kitwe. 29 were done out of routine screening. 22 in Lusaka, 5 in Ndola, 1 in Mufulira, 1 in Chinabombwe, and 6 were healthcare workers 4 from Kamushi, and 2 from Lusaka. 4 truck drivers tested positive in Lusaka. In terms of the deaths, we have recorded 128 deaths in whom COVID-19 was isolated. This follows 2 more deaths from Levi Mawasa Isolation Center and UTH. The cumulative number of deaths classified according to World Health Organization guidelines as follows: 28 COVID deaths, 92 COVID-associated deaths, and 8 have been reviewed pending classification. As a way of reminder, those who will be classified as COVID deaths will have COVID as the primary cause of death. They will have contracted COVID, developed complications of COVID, pneumonia, organ failure, and succumbing to death. Those that will be COVID associated will be those who will have other morbidities which would still claim their lives, but were also found to have COVID, and COVID not being the primary cause of death.
The minister says the country is in a dangerous surge of the virus due to the cold weather, and higher cases may be persistent until August, but he says collective action can minimize transmission. Constance Mwemba reporting for Camnet TV News, Lusaka.
Meanwhile, Parliament has announced that parliamentary business will be held virtually. Clerk of the National Assembly Cecilia Mbewe, in a media statement, says members of Parliament will not be physically present at Parliament buildings Tuesday. Ms. Mbewe says MPs will participate in a sitting from their respective homes and rooms at the National Assembly Motel or any other locations. According to the order paper, there is only one notice of motion, which is to adjourn parliamentary business in view of the coronavirus. Parliament is now expected to resume in September. Still on COVID-19 related news, the Human Rights Commission has called for renewed adherence to set health guidelines in the fight against the pandemic. Commission Public Relations Officer Mwelo Amlea notes with concern that Zambians have relaxed in adhering to COVID-19 guidelines, hence a surge in numbers. More in this report.
The Human Rights Commission is deeply concerned at the increasing cases of coronavirus, and we call for effective national leadership and revival of the campaign to combat the global health pandemic. We have been, as a Commission, interacting with the individuals in urban and peri-urban areas to assess the levels of compliance to the public health regulations and guidelines. Our feedback or findings are that some people don't believe that there's coronavirus in Zambia. And those who believe that there's coronavirus do not believe that coronavirus can kill. And this is causing a lot of lack of adherence to social distancing, masking up. And this shows that people are actually dying, and that we have limited capacity to test, and that some people are self-quarantining themselves for various reasons, sometimes without any medical attention. And these are the challenges, I think, as a country, we need to confront head-on and try to address.
Farmers in Chilanga's Mwembeshi area have hoped that government will this farming season deliver farming inputs to them on time. The farmers explained that late delivery of farming inputs affects their planning and agricultural activities. More in this report. The 110 kwacha crop price for a 50 kg bag for the 2020 marketing season, as earlier announced by the Food Reserve Agency FRA, has continued to receive criticism among members of the public, including farmers. Reports in some parts of the country allege that farmers have now resorted to shunt supplying of the commodity to FRA, but have since considered private buyers. Efforts to get a comment from FRA proved futile by broadcast time, as this reporter was requested to send them a press query. However, adding on to complaints that the crop price is little as compared to the cost the farmers put into their production activities, the small-scale farmers in Mwembeshi have complained of the delayed farming inputs, a situation they have likened to adding salt to a wound. The farmers have said that it has become a trend as farmers have always been affected by the late delivery of fertilizer, such as low crop yields, which they admitted increased poverty levels in the area.
Imafuna vintu vambiri maningi. Imafuna for instance manguala, fertilizers, na vinangu. But fertilizers yapezeka kuti yachedwa kufika pano pa Mwembeshi. Chifukwa chakuti ka stiziva kapena ma suppliers yayo olokapena ma cooperatives yachedwa kuti submit ndrama. But chene ma fertilizers ndio kuti vantu tibalime.
They have further recommended for government's intervention in order to avoid the situation from reoccurring in the coming farming season. Reporting for Camnet Television in Lusaka, Zambia, Namwenga Mwinga. Former Zambia's ambassador to China, Chilufya Kapwepwe, says the continued tribal divisions in the country is depressing. Ms. Kapwepwe says tribal divisions must come to an end and allow the spirit of oneness to take center stage. The former envoy states that Zambia was not established on tribal lines, hence the need for Zambians to learn to live as one, as opposed to a growing trend of people fighting one another based on tribal lines. Ms. Kapwepwe made these remarks when United Party for National Development UPND Secretary General Stephen Katuka visited the home of Zambia's independence struggle hero Simon Mwanza Kapwepwe in Chensali on Sunday.
The unity of purpose that was our founding fathers.
It's no longer there.
It's no longer there. When I look at you, I must be asking, she's from Chinsali.
Can you imagine?
Yes.
That is the first thing you say. What's your name? Oh, she's Bembe.
She's Bembe, yes.
It is so unfortunate.
What's wrong with being
And yet what we should be fighting is to keep a white man who hates us so much and who is after our resources in Africa. That is what we should be worrying about.
And you can see that people have even time to plan 30 years to terminate the black race.
Yes. They are
planning that this will kill every African and take over the country. And we never think like that.
I was
we are short-term planners.
The racism that is there, diplomatically, yes, it will be very nice too because they want things from you. But those guys, their vision and what they've decided they want out of Africa is totally different. But we seem to be accepting back, anybody who comes.
No, those accepting them is because they are getting kickbacks. It never happened during these people's time.
What we've done, it is painful for our generation that has lived from the time when we saw, our fathers fighting for independence and how they were killed. I mean, really, it should prick your conscience and say, is this what they fought for?
I tell people that some of us were fortunate that I have been in the colonial era.
We now take our first set of commercials. More news lined up for you. Keep watching.
To create a positive difference in people's lives, one must first understand the way people live. At Savenda, we're here for our community, our partners, and our future, as a nation and as a continent.
Back in 1997, we decided we were going to create this family journey into a bigger opportunity, and created a business called Savenda, which meant save nations to develop Africa.
It's always important to give back to the people. The government cannot do everything, but as business entities, we'll be able to reach a lot of people.
From our humble beginnings in the telecoms and mining sectors to our work in energy and development projects, we know how important it is to be true to our roots.
Our services have to be diversified so that we don't depend on one income stream. Back in the village, I was growing up hunting and doing everything that a village boy would like to do. When you're hunting, you don't depend on one trap, for example. You have to have many traps. So those survival skills brought into the business created opportunities that we learned from a young age that you can't survive with just one product. Savenda Group involves Savenda Management, which is a consulting, Savenda Express, which is a corporate branding company, Savenda Electric, which is a manufacturer of energy-saving bulbs, Savenda General Insurance, which is a general insurance company, Savenda Fresh Produce, Cyber Africa, which is a center for just dealing with cyber security.
Now, Savenda is combining local knowledge with international expertise. It's time to be a part of Zambia's rising success and Africa's exciting future.
We are a gateway into Africa, and now we are praying with global companies who are coming to Zambia for opportunities and to look for companies that are homegrown, and we are proud to be one of those.
Welcome back. You're still watching Camnet TV. Camnet's not just another channel. And now the rest of the news. The Higher Education Loans and Scholarship Board has reviewed that a total sum of over 65 million kwacha has been recovered since September as of 30th June 2020. Addressing the media Monday morning, Higher Education Chief Executive Officer Irene Chirwa says since the commencement of recoveries in 2018 under the Loan Recovery Program, the number of institutions remitting on behalf of their employees has been increasing from one institution in 2018 to 13 by second quarter of 2020. She says this due to the ambitious rollout plan being pursued by government.
They don't need to wait for us to approach their employers. When one reads our act, it actually gives the opportunity for a loan beneficiary to approach us as soon as they are able to start paying back. Everyone has a one-year grace period after they leave their institution of learning, either by graduating or if they've left by any other means. But they don't have to wait until the end of the grace period. They can approach us anytime as soon as they are able to pay back. We need these funds, like I said, to support other students. And they're waiting for us to approach the beneficiaries who already know that they are under obligation to pay back has sort of slowed down what we should have been recovering. Though we have recorded success, but we should have actually recovered much more if the loan beneficiaries were not waiting for us to approach them. Thank you very much. Unless there are questions, I can take at this moment to clarify one or two things on what I've presented, and like Edia said, anything to do with the Higher Education Loans and Scholarships Board. Thank you.
Meanwhile, Ms. Chirwa says the Scholarship Board has awarded loans and bursaries to 20 students living with disabilities from the University of Zambia, Unza, 4 at Kwame Nkrumah University and 6 at the Copperbelt University. She says each year 10% of the funds are allocated to students with disabilities, but that it is barely taken up. Ms. Chirwa is hopeful that with the sensitization, a lot of people will be able to compete for the 10% student loans.
Academic year, we gave out 20 student loans to students at the University of Zambia, and another 4 at Kwame Nkrumah University, and 6 at the Copperbelt University. Unfortunately, we didn't record any for Chalimbana University, Kapasa Makasa, Kwame Nkrumah, and the Bukoba University. So we are hoping that with the sensitization that we have done, we should have more students living with disabilities that should be able to apply for our loans, because we have a 10% allocated to students living with disabilities. The criteria that I talked about is such that we have the first 30% given to meritorious students. So everyone is able to compete in the first 30%. Then the next 30% is given to students who are coming from rural areas. So the students coming from rural areas will compete in the first 30%, and then they have their own allocation of 30%. The next 30% is given to female students. That brings it to 90, and the last 10% is given to students living with disabilities. So far, the 10% has not been exhausted by the students living with disabilities. So we end up giving the remaining percentage to meritorious category.
The Jesuit Center for Theological Reflection, JCTR, has charged that slackness in COVID-19 measures is a recipe for disaster. Speaking in an interview with Camnet TV News, JCTR Executive Director Father Alex Miyebe attributes the increase in non-compliance of the health measures to the failure by Ministry of Health to give daily updates on COVID-19 pandemic. He notes that the daily updates served as a reminder to people about the pandemic, especially now when the numbers keep increasing. Meanwhile, Father Miyebe says it is shocking that the National Assembly, an epitome of policy making and lawmaking, continues to operate despite some of its staff and some members of parliament having tested positive for COVID-19. JCTR has since urged government and other stakeholders to aggressively step up community education on COVID-19, scale up screening and testing.
Daily updates on COVID-19 were dropped, understandably at the instruction of the head of state, because the Ministry of Health was advised to concentrate on fighting the pandemic. We've seen there's been some laxity there. And it's now evident that when you go about like visiting the communities, you see people moving up and about without wearing face masks. And the same applies to people in the bus stations, on the minibuses. The people are going about without wearing face masks. And that's very clear evidence that people are no longer complying to the COVID-19 preventive measures. So we are very concerned that this laxity on compliance to COVID-19 preventive measures is taking place at a time when COVID-19 transmission in the communities is steadily increasing. And so this is a recipe for disaster. And we are urging the government to take a few measures. For instance, to step up community education on COVID-19, because some people don't believe that COVID-19 is a reality. They think it's a hoax.
Meanwhile, the surge in the coronavirus pandemic has provided a good market for traders dealing in masks. This is after the business went down after people stopped buying masks on account that the virus was just a hoax. More in this report.
About 65 youths have decided to be innovative by producing face masks to help combat the deadly coronavirus. These youths say coronavirus is real and have advised Zambians to follow the preventive measures such as the wearing of face masks, washing of hands, and maintaining of a social distance.
Honestly speaking, I think for those that are still thinking COVID-19 is a hoax, I think it's very unfortunate and very, very risky. COVID-19 is real and it is so dangerous. It does not even give a single second to play with it. The moment you risk yourself and make yourself available to be caught up with COVID-19, the chances of surviving are very slim. Powered and driven by youths, We have a total of 65 employees, and out of these 65, 61 are youths who are working the day and night shifts to produce a minimum of 7,000 face masks per day, as you can see from the back, which is the final product that we do. The motivation for us is the call by His Excellency the President in encouraging all responsible citizens to be part of the solution. And by way of adhering to that, we thought it was necessary for us to take a part in the fight against the COVID-19 by way of producing this much needed essential good, which is the face mask. And this production has seen a number of youths who came to this project without even knowing anything to do with a sewing machine. And today, as we speak, they can testify on their own. Apart from just the employment that they've been given, they are also thinking as entrepreneurs beyond first right investments, because they now believe in themselves and they know that using their hands, they can complain less and be part of the solution.
They have advised other youths to be innovative during this COVID-19 era. They have said despite delayments in paying of face mask makers by the Disaster Management and Mitigation Unit, DMMU, they shall soldier on. These youths are aiming at making over 7,000 face masks per day. Constance Mwemba reporting for Camnet TV News, Lusaka.
National Restoration Party Secretary General Ezra Banda has charged that Zambia is not ready to handle COVID-19 cases as seen from the dates that are currently being recorded. Mr. Banda notes with sadness that 2 members of parliament have died from suspected COVID-19 without any action being taken by the Speaker of the National Assembly. He says as at now the House should have been adjourned to save lives in the earnest. Mr. Banda says even if others want to continue pursuing the controversial Constitution Amendment Bill number 10 using Parliament, they should first consider the lives of others and put aside their interest.
As National Restoration Party, would like to offer our condolences to the nation over the death of our 2 parliamentarians, as for Rukasha and Masawombo. Further, we want to extend the same to the constituencies, the PF, and the communities where these people are coming from. This is a huge loss of our lawmakers. To lose them at a short period or within 24 hours, you lose 2 of them, is quite very huge, and it's a huge blow. Now, as NAREP, again, our position is such things could have been avoided had we adhered to the rules of which and the rules and the guidelines which are provided by the Minister of Health. You see, as a country, I don't think we have the capacity to handle such cases. I would say like that because I'm very mindful that one of the late lawmaker was actually taken from a private clinic to Levy. And when they reached Levy, they found the ventilators are not working. So they were in the process of transferring the same person to UTH. And on his way, he succumbed to the disease. So this shows that we are not ready as a country. Nobody should cheat us that we are ready. We are not.
We now take our final set of commercials. Don't go away.
Stay home, stay safe. Times have changed. With the advent of the coronavirus, Lusaka Water Supply and Sanitation Company would like to advise its esteemed customers to avoid visiting crowded places. You don't have to move to pay your water bill. You can do it in the convenience of your home. You can pay your water bills through Zanaco Zapit, Stanbic Bank, Standard Chartered Bank, and FNB. You can also use Airtel, MTN, and Zamtel Kwacha mobile money transfer services. For any inquiries to report a fault, please contact our customer service on +260 211 251 571, +260 975 618 618, and toll-free line 5957, Zamtel only. You can also simply email customer service at lwsc.com. This public announcement is brought to you by the Lusaka Water Supply and Sanitation Company. Water is life. Sanitation is health.
Msika is here. We have you all covered with just 150 kwacha. You can advertise every day from 17 hours to 18 hours. For a 30-second ad, get the benefit of selling your products and services on Msika. For more details, call our marketing department on +260 953 995099 +260 962 444 726 or +260 971 177 467. Email us on info@camnettvafrica.com. Terms and conditions apply.
Thank you for staying with us. You're still watching Camnet Television, Camnet, not just another channel. And in international news, preliminary results of a clinical trial suggest that a new treatment for COVID-19 reduces the number of patients needing intensive care, according to UK company that developed it. The treatment from Southampton-based biotech Synergen uses a protein called interferon beta, which the body produces when it gets a viral infection. The protein is inhaled directly into the lungs of patients with coronavirus, using a nebulizer in the hope that it will stimulate an immune response. The initial findings suggest the treatment cut the odds of a COVID-19 patient in hospital developing severe disease, such as requiring ventilation, by 79%. Patients were 2 to 3 times more likely to recover, to the point where everyday activities were not compromised by the illness, Synergen claims. It is said the trial also indicated very significant reductions in breathlessness among patients who received the treatment. And finally, in sports news, Messi, Ronaldo and Co miss out as 2020 Ballon d'Or cancelled due to coronavirus pandemic. France Football has announced that the prestigious prize will not be handed out this season due to the lack of sufficient fair conditions. A prestigious Golden Ball has been handed out to the best player on the planet since 1956. However, the decision has been taken that it would not be right to pick out a leading performer, given a circumstance in which professional sports is currently being played out. Here is a report.
The coronavirus has continued to affect every sector, be it social or economic. The sports fraternity has not been spared, as most of the sporting activities were suspended when the pandemic broke out 5 months ago. The effects of the pandemic have continued, which has resulted in the prestigious Golden Ball Award, known as Ballon d'Or, being cancelled. French football has announced that the prestigious prize will not be handed out this season due to the lack of sufficient fair conditions. The prize, that has been dominated by Lionel Messi and Cristiano Ronaldo in the recent times, will not be awarded for this calendar year. A prestigious Golden Ball has been handed out to the best player of the planet since 1956. However, the decision has been taken that it would not be right to pick out a leading performer given the circumstances in which professional sport is currently being played out. This means 2019 winner Messi will keep his crown for another 12 months. The Barcelona superstar has 6 Ballon d'Or awards to his name, with rival Cristiano Ronaldo of Juventus boasting 5. Sharon Kalimbula, Camnet Sports, Lusaka.
We've come to the end of Camnet TV News. A recap of the top stories. Health Minister confirms Mwansabombwe MP dies of COVID-19 related illness. Mwembeshi farmers call for early distribution of farming inputs. Government recovers 65 million kwacha student loans. In international news, COVID-19 proton treatment trial in a breakthrough. In sports news, Ballon d'Or cancelled due to COVID-19. And finally, our Camnet World Verse of the day is coming from the book of Psalms 9 verse 9, which says, "The Lord is a refuge for the oppressed, a stronghold in times of trouble." This has been Namwenga Mwenga. Until next time, stay blessed.